And so Agatha goes on, setting this frame has made a dramatic change. She's so much now trying not to put a knife into herself. She sometimes does something else, but right now she's doing well in reducing her acts. For instance, she just went to the pharmacy intending to buy analgesics or something, but changed her mind in the store and just bought some cosmetic cream. It has now been possible to identify the mental structure inside of her. She says the liquids as well as the crust. This therapist had read my book, A Pattern of Madness, where I talk about a jelly and liquid and crust. And then she says the staff around Bernadette are now having a better time, including me. Dialogue has been possible, and I can speak to her in clear language. Real therapy is happening. She's more integrated, and I'm more at home in the work I'm doing with her. Now, this was written nearly a year ago now, and since then there have been very significant developments. Bernadette now has the care of her 2 children for 3 hours each week. She has a part-time job in the bakery where she makes sandwiches and lays tables in the cafe section. And whereas 9 months ago she only saw her sister in terms of the way that the sister had an effect on her, she now sees her sister's own problems and her sister's own difficulties, so she's sort of aware of the sort of problems and difficulties of the other person. Bernadette's own ex-husband is clearly becoming more fond of her, as he was when they first married, and this, as you can imagine, has brought problems with her ex-husband's present wife. But I continued to supervise Agatha, and the change in Bernadette has been quite remarkable, whereas, for instance, she'd been tremendously overweight. She's now quite normal sort of weight. She bicycles to work, bicycles to the consulting room, and her state of health is really quite remarkable. And so I quote that as a sort of a case where Agatha, and you can see what Agatha went through in it, even sort of wishing at some points that Bernadette would die. Okay, so that's, I just give you that one case just to illustrate the fact that here, even with a very, very disturbed patient, the way that she was receptive to Agatha's communications. I think a very important thing with Agatha herself, she didn't have a very extensive training, but she had that real sort of spirit of inquiry of trying to understand why these things happened and what was happening and why she was feeling in the way that she was.